Good afternoon, everybody. I hope that you're all doing well today. I am Mindy Griffith, the Executive Director of Bagot, as she said, and I am excited to be here from Tucson, Arizona, as I slowly figure out time changes and hope that wherever you are around the world, because I think we're a little bit global. So I am going to get started. I am going to share my screen with you today, just so that you have a little glance at the slides as I go through and talk about them. I think I'm in full screen there. So I'm going to talk to you today about a care plan as well as about self-advocacy and how those pieces all tie together. So let's start a little bit with, I work with Bagot. As she said, Bagot is our primary goal is to empower anyone with any type of cancer to be their best advocate. So this is right in line with everything that we do. Just a quick slide from Dr. Patricia Gans, a founding member of NCCS, the National Coalition for Cancer Survivorship. And one of the things that I think is really important to pull out in what she says is that first line, is knowing as much as possible about your disease, its treatments, and its potential effects on your body can empower you to take charge of your health and help you make the most of your survivorship experience. And that's really a lot of what Bagot is and does, and what having your care plan and all of that ties into. So first, just a brief review of self-advocacy. Really, that is your ability to communicate your needs and to make informed decisions about the kind of help and support that you want. Remember, a cancer diagnosis, and with any diagnosis, it's all impacting you. And so you want to make sure that you've armed yourself with the tools and skills so that you are comfortable asserting yourself, so you can take that responsibility. When we look at why self-advocacy, we know that being your own self-advocate and speaking up for the good of your body and your own life is important. You need to play that whole healthcare team. You are the crucial part. You are the center part of that healthcare team, and you want to make sure that you're doing that to improve your relationships with the team, to ensure that you are getting the best quality of care that you deserve, to improve your long-term health, and make sure you're getting your needs met, and to really voice those personal preferences that are impacting you. And a lot of times to just have control over something, right? It's a tough time, so you want a little bit of control over what's going on. When we look at it, we talk about self-advocacy for both the patients and the providers, and how that benefits both parties. So for a patient, it provides you an opportunity, as we said, to get your needs met, to voice those personal preferences, maintain a level of control, to live your best quality of life with cancer. And for the providers, a self-advocate patient suggests patient competence in managing and preventing their health problems. And a lot of times you will see that you are more adherent to treatment, and you have that improved communication with your healthcare team, which can improve your outcomes. Some of the main elements of self-advocacy: information seeking. Those skills are really developed by you as a survivor to educate yourself as thoroughly as possible about your cancer, the treatment options, the side effects. We know you're not the doctor, but it's still important that you have that information on it. Communication skills to help the survivor have those thoughtful interactions with the healthcare team and avoid misunderstandings. Problem solving, similar to your decision-making skills, and help you approach your problems again with a team approach. And then your negotiation skills, teaching the survivors, you, to address the issues that are personal importance, to find the balance to get your needs met and what you need to find that healthcare. Which really leads perfectly into having those skills for the full spectrum, but looking at shared decision-making. And hopefully many of you have heard of shared decision-making, are familiar with it. But oftentimes, when it comes to making important medical decisions, many people are very overwhelmed and are unable to fully comprehend all their options. And so while the majority of patients desire to have their healthcare providers share the best information available to help them, you need to be part of that medical decisions that are made. Excuse me. I wanted to just give you the brief definition that we're using from the Agency for Healthcare Research and Quality. It defines SDM as an open communication between the patient and the provider who work together to determine a care or treatment plan outlining the risk and benefits while balancing patient values, preferences, and medical best practices. So when we look at that, evidence has shown that SDM really improves the patient outcomes. It supports patient engagement and results in care that's aligned with your preferences. And it's not happening everywhere, but it is happening, and it's something to really be a part of. Just quickly for providers, some of the best practices with shared decision making, a little tongue twister there, is assessing and addressing your values, your preferred language, and health literacy levels. We know that if we are able to understand that health literacy is so difficult for any of us, and then if you're putting it into the language that is not your primary language, it can be even more challenging. So making sure that information is available for you. Practicing active collaboration, using evidence-based educational resources and decision aids. And one of the key things that Bagot offers is we have a Bagot bag. I'm looking because I have had it right here with me, but we have a bag that has a binder and everything in it to help with those printed booklets, that information to help you make those decisions and to understand what's going on. And then also for best practices, for them to really streamline SDM into their daily workflow as part of that. So those are some of the best practices on the provider side, which as a patient is always important to understand. So as we look at filling our toolbox to help you be that best advocate, we look at our Bagot name and looking at those 4 elements, and we just have a little tagline to help you remember. I was a teacher in a former life, and so still that education piece in there, but reminding you to be prepared to assert yourself, gather your information, inform the doctor, and take an active role in your healthcare. What does being prepared mean? It really means writing down information ahead of time. How many times do you get to the appointment and you forget all your questions, or you're overloaded with them, or they're out of order, you don't remember the primary one? So go in and be prepared for your appointments. Prioritize your questions so that you maybe can ask your doctor your top 3, and then find out who else on the team can you go to get other information answered and get those other questions answered. Have goals for your appointment. In the Bagot bag, we have a lot of forms in there to kind of help do exactly that. Be prepared for your appointment, write down those questions, write down your symptoms or any concerns you have. Remember, you're part of this team, and the doctors can only do so much if you're communicating with them and telling them what's going on. Take somebody with you. I know right now in COVID, some providers maybe only are allowing one person, the patient, in, but you can still pick up the phone and have your caregiver or a friend or someone be on the other line to be part of that appointment. Write down as much as you can, or have somebody recording it, or record it with your phone and with that person online. And really keep track of those symptoms and side effects and share that with your medical team. Assert yourself. Something some of us are not always as great with as we want to be. And I know for me, I trust the medical provider and they're doing their job, and I sometimes might feel a little inferior to them. They have a lot more schooling than me, but I'm asserting myself because this is my body and this is impacting me. So look at, how you communicate with people, and not just your healthcare team, but your caregivers, your family, your friends. Make sure that you're clear and confident when you're talking to them. Ask them questions, but communicate all aspects. Communicate your concerns. Communicate your desires. What is it you want out of things? I have a friend of ours that's a Bagot ambassador, and one of the things that she went to 20 different doctors to find one that would support her in riding her bike and being physically active throughout her treatment and her chemo and everything. And that was important to her, to be active on an ongoing basis. And so she had to communicate her desires there. Communicate your needs and your obstacles. I mean, is getting to an appointment every day going to be challenging for that time period? Is it costly? Do you not have a vehicle? Are you taking public transportation? Is the cost to pay difficult? You need to let them know that, because that healthcare team, again, is part of a team, and they are there to help you and support you in making sure that you can get the treatment so that, again, that you can have that best quality of life. Gather your information. We know in this day and age that many of us are headed off to visit Dr. Google and see what he's going to tell us. But we also need to remember that information is changing daily. Oncology is moving quickly and it's happening. And so making sure that the information you're researching is recent and that it's backed by science, that you're getting it from reliable organizations. So how do I find that information? You look at some of the national cancer organizations, ASCO and Cancer Care and NCI and NCCS, and research your condition, gather your information, but do it responsibly and from reliable resources. So our website, fagotcancer.org, has over 150 different resources and has links to some of those to all those I just mentioned above. But it's also a great starting point that you can get there and then venture out to find more information. Inform the doctor. This kind of goes back to communicating your needs, but you need to tell them, about your lifestyle. Are you an active person? You need to talk to them about your diet. Are there certain things you typically don't eat? Because they don't know all your allergies or what makes you, maybe it's not an allergy, but it makes you nauseous on a regular basis. What kind of exercise are you doing? What medications might you be taking? Sometimes we think it doesn't matter that we're taking a vitamin B or fish oil or something, but that could really impact the treatment that you have and what else is happening there. So you want to make sure that you are sharing that with them, right? If you're using medical marijuana, these are all things that we're so hesitant to tell our doctor the quote unquote we might think are bad things or that isn't important. They need to know you're getting important treatment and they need to know all these aspects of it. Also, mental health. Are you prone to depression or anxiety? That's going to impact them so that they know when you're going through a treatment if this is maybe a side effect from the treatment or if this is kind of par for the course so that they can figure out how to adjust things appropriately. And then take an active role. Goes back to the shared decision-making concept. And again, reminding you are part of your healthcare team, right? Like, call your doctor if you don't remember something. If you're confused, make sure that you're following the instructions they've given you correctly. You're trying to improve your quality of life, not the doctor's. It's your quality of life. And so you need to figure out what's happening there. But you also need to make sure you're getting your recommended treatments and screenings. We know that we saw a lot of patients once COVID hit, that people were really hesitant to get back out there and to go see their doctor, maybe putting off their mammograms. I know friends of mine doing things like that. You still need to make sure you're getting your recommended treatments and screenings. If you don't feel that you want to go in or you're not comfortable, then you can speak to your healthcare team about that and say, oh, they're the ones that can help you collectively make that decision. The same way, if you have a fever, you don't necessarily need to go to the ER right away, but you do want to let your healthcare team know and help decide collectively, do I need to go see someone for this? Take your medications as prescribed. How many times in our youth have we gotten something, or my cat takes medication sometimes, I get it for him, it's 10 days, down to the last day, he's getting difficult about it. I'm like, oh, his allergies are gone, he's cleared up, so we don't think we need to give it to him anymore. But it's there for a reason for 10 days, right? So make sure we're taking things as they're prescribed. Take an active role and interview your doctor. It's one of the things that I know I don't enjoy finding a new doctor. That takes time, it just takes the extra energy. But you want to make sure that this is a match for you. This is really, really crucial, and you need to make that match work for you. Leading into that, getting a second opinion, right? When we're booking a travel, when we used to book travel, hopefully we'll be booking travel again soon, or taking our car in, we don't just book the first hotel that we see. We're looking for its location. Does it work for us where it is? We're looking for the price of it. We're looking for customer service. Could I relate to them? Did I feel connected? You can do the same thing with your healthcare team. And it's really hard, right? We don't want to offend our current doctor. I mean, have you ever tried to go to a new hairstylist, especially if you're female, and you don't want to offend somebody, but it's important. Remember, this is about you and your best care. But also getting a second opinion can really validate the treatment that was already recommended, help you decide what you might need. Sometimes your insurance companies may or may not pay for it, but sometimes they might really encourage it. If you're unsure about the diagnosis or it doesn't seem quite right, if you have a rare or advanced cancer, like I said before, cancer is changing daily, and some doctors have more experience in different types of cancers than others. So it's okay to go and find out about them. When you're doing that, just kind of talk to your current doctor, include the need, talk to them about getting that second opinion, find out from your health insurance company if they're going to cover a second opinion. Some will require it, some might not cover it, and it could be very costly. Schedule that visit, have your first opinion record sent over, and then after your second opinion, have those sent back. And keep track of everything. One of the things with Bagot is that it's a bag, and it has a binder in it. Actually, I have another screen here. It has a storage binder as well as 4 publications in it, and we are constantly reminding people the importance of keeping track of your own records for everything. And when we start talking about the care plan in a minute, it will be even more prevalent, the benefit of keeping track of all that. But knowing that all the electronic health record systems, as many of you probably know, do not communicate with one another, or your records might not get to your second opinion or to your surgeon or to a different oncologist in the same amount of time that you're there for an appointment, and they might cancel it. So you want to make sure that you're keeping track of your information and that you're responsible for your records as well, and don't be totally dependent on your healthcare team. The binder, as well as on our website where you can download them, has a lot of great checklists and calendars. So some of the things I've talked about, get a notebook, write it down, but keep everything in one place to make it simple for you as well as a caregiver. If you're taking somebody with you to appointments, or somebody else is helping out, or if you have multiple people, having all of your information in one place can be really valuable. The calendar's in there, the blank log, so you can track medication, so you can track the symptoms and the side effects to be able to share that back with your healthcare team. Because again, they need to know that. There's also a glossary and resources in there. And then there's a couple different publications, so designed to help support you through your treatment, and then prep for questions to ask your healthcare team, understanding side effects. The Paths to Survivorship booklet has information for after treatment, as well as chronic cancer diagnosis and being prepared for that. So we're so fortunate that people are living so much longer after treatment now, but with that comes a whole other game, right? All right, so now on to a little bit about care plans and tying in with being, again, your own self-advocate. Okay. So let's take a breath. So a cancer care plan. So the Institute of Medicine researched the state of cancer care for survivors, and the NCCS definition of survivor is from the day of diagnosis. Many people don't feel that they're in that until after treatment ends. The definition that we use with Bagot is from the day of diagnosis. But there was little guidance available for survivors and their healthcare providers to help overcome those medical and psychosocial problems that arise post-treatment. As I said, we're living longer after that active treatment, which is phenomenal, but with it comes a whole other game that we weren't ready to play yet. Okay? So your cancer care plan is really a roadmap to show you where you're going, where you've been, and where you're going, and how you're going to continue going forward. It's something that should be discussed with your healthcare team and with all other health professionals that you're seeing. Your primary care doctor, who we often kind of forget about including that in, a radiologist, a surgeon. So it's basically a plan for wellness to help you continue to receive the best healthcare. Okay? A record of your cancer and your treatment history. It should have clear designation of the provider responsibilities for both oncology and non-oncology, avoid unnecessary use of resources, and ensure that care does not fall through the cracks. So there's 3 different aspects. Sometimes you'll see them mixed together, pulled together. You have the treatment care plan, which is really the plan that should be in place before you begin treatment. So once you go see that first doctor and you get that diagnosis, that's what you should be working off of, is your treatment care plan. Then you have your treatment summary. So as you're transitioning off of active treatment, this is really important to get. This is with your bag, or your notes and everything, as you've been accumulating all of your paperwork, this is what's going to be in there, but this is a summary of it. You're not going to hand a new doctor or a new oncologist, or if you move towns, you're not going to hand them this thick binder and say, here's my history, because they're not going to read it because they don't have the time for that. But a summary is kind of a quick recap, and we'll go into some of the specifics that are included in there. But it kind of has a list of the medications that you're taking. It talks about your what your stage of cancer was, what the diagnosis was, all the details about it, and what treatment that you had, and how you responded to the treatment. Then the other part of that, and sometimes they're called together, the treatment summary and survivorship care plan, but is the follow-up survivorship care plan. And that's really that follow-up care for after treatment for life. So the summary summarizes what's already been done, and then you've got your moving forward, your care plan, okay, to help map out that. You really, as a cancer survivor, you're going to be monitored for the rest of your life, right? And we have different healthcare needs than we did before we had a cancer diagnosis. And so this care plan really helps to ensure that all the members of your team know what follow-up is needed, when it's needed, and who you should see for that care. So the benefits of having these plans, it records your specifics of cancer, it records your treatment and nuances, helps you manage recovery, better prepares you for new healthcare needs, makes it easy to share with other doctors, and it also ensures your best possible future healthcare. One of the, I have a friend who hit 50, right? So it's time for your colonoscopy. And he was being treated for blood cancer. And so we've seen his oncologist for that, but we sometimes forget our regular preventive ongoing because we're not seeing our primary as much. So having this information in your care plan and a reminder so that you've got everybody looking out for all aspects of you and what you need to make sure you're taking care of. So a little more detail on the treatment summary. Okay. So with your treatment summary, you've got details of your diagnosis. So the date of diagnosis, the type, the location, the stage, the grade of the cancer, right? Quick summary. You've got the types of treatment. Did you have chemotherapy, radiation, surgery? And if so, what are the dates? What's the type, the dose, the procedure that was done? Where was the surgery done? What kind of side effects or complications maybe that you had with that? So if unfortunately there's a recurrence later on or a medication down the road that might impact you, they know that this hurt. This didn't work with you. This didn't sit with you. This made you nauseous, so they can be fix that. And obviously, even 5 years later anymore, I mean, things can be totally different. It has the contact information for your doctors, your healthcare team, the facilities that you were at. So if you need to go back and find anything, that information's there. It has your genetic testing results, if they're applicable. And any supportive care that you may have had. Did you have extra nutrition needs because you were losing weight or gaining weight or sugar? Were they having to monitor things? Any psychosocial needs that were taken care of? Physical therapy. My mom often has really bad leg cramps when she goes in for a treatment. So trying to be careful of that and how she can, what medication she's taking with that. Any complementary or integrative medications or treatments that you had or partook in. So again, this is a summary of everything that happened during your treatment. And then you've got your care plan. So this, again, they're kind of one and the same. But your care plan is really taking that, the follow-up care part of it, where you're headed down the road, right? It has the state of your current health. So finished treatment, here's my summary, but how am I feeling? Where am I at today? Am I still really fatigued on a regular basis? Am I still having issues with my diabetes or my thyroid? So it's still there and how that was managed, but my state of my current health. It has recommendations for your ongoing care. So it's got, this is when my next screening needs to be. I need to have, a lot of times right after treatment, you're coming in every 3 to 6 months, or do I need to come back in a year? When do I need to schedule that down the road? Your surveillance testing. It has information about late and long-term side effects. So if you're not as familiar with those, late effects are side effects that you might not show up for months or years after treatment, right? We didn't get them now, and because we're continually finding new treatments, we're not always sure of the long-term results, and for every patient, everything is different, right? In addition, your long-term effects, it's a problem that's caused by the disease or treatment. And so it may continue for months or years, heart problems, stamina, fertility, which is something that hopefully you discussed in the early stages when you were being proactive and advocating for yourself during that early part of the diagnosis and saying what treatment is going to impact me to have children if you're at that stage and want to be doing that. You need to ask your doctor how treatment could affect your long-term health and mental functioning so that you can properly be prepared for that. Also, you want to talk to them about lifestyle recommendations. Physical activity. How active can I get? How quickly can I get active? Is it based on how I'm feeling? Do I need to be cautious of anything? I know that someone has told me a story about a childhood cancer survivor who at like 3 had a blood cancer and was doing great, and so come high school, they're starting to play sports again and everything, and they're playing soccer. And if you've ever played soccer or seen it, you get kicked in the leg a couple times. And this individual was kicked in the leg and got a blood clot, which I've had those playing soccer. They happen, but as a cancer survivor, it's something to be extra cautious of, and that might have been a activity that wouldn't have been ideal to be playing for this particular individual, no matter how many years later. But 10 years later, the child doesn't remember it, right? And the parent doesn't remember it because they're so happy that things are good and their child's playing soccer. But having all of this, your treatment summary and your care plan, 20 years later, you think you're never going to need that again, and you hope you're never going to need that again, and many times you won't. But sometimes it does happen, or it might impact a different part of your life. Again, those long-term effects. So it's important to keep this forever as part of your plan and part of your medical records. The emotional side of it, right? What do I need to be aware of? Am I more prone to anxiety? Am I more prone to depression? Smoking and alcohol. Now, let's be real. We all know we're not supposed to be smoking anyhow. But if it's something that you have and that's there, talk to your doctor about it. Again, alcohol. Sometimes you shouldn't be doing it at all. But maybe is one glass of wine once a week going to be okay for me? Talking with your providers about that as you put together this care plan so that you know where you are and what's happening with that. Now, where and how do you get a care plan? Now, in an ideal world, your doctor is going to just hand one over to you as working with you to compile this and pull that together during your treatment or when you finish your treatment as you're transitioning. If you did not get one, what are you going to do? You're going to advocate for yourself, and you are going to make sure to ask and inquire about one. I can tell you that one of the challenges is that they are very time consuming, and medical providers are not getting reimbursed for them a lot of times. If you're at a smaller facility in a more rural area, it might be more of a challenge. They just might not have the staff or the time to pull it together. But that doesn't mean that you can't ask and still get one, because you're advocating for yourself, for your best quality of care. So you can also help move this along. So NCCS, the National Coalition for Cancer Survivorship, has some great information on their website. They've got a whole survivorship checklist on there. We have one in the bag as well. Just kind of some things to keep in mind as you're going forward, right? And that planning of it. And then you have, it's got tips on mistakes to avoid and errors as you transition to that treatment. So then, and they also have links to ASCO, which I'll show you briefly that template just so you have an idea of what one looks like, and OncoLink. ASCO is a printed one. We used to put it in the bag. Now we just kind of reference it because many people, ASCO is the American Society for Clinical Oncology, sorry. And many times it's going to be modified. Everybody's using their own. Your medical provider might have their own that they're using, but it's a great template to kind of help you stop and think about it as well. OncoLink is an internet-based care plan available in both English and Spanish, and multiple people can enter information. So you as the patient, your doctor can enter information, the caregiver can fill in data, and then it kind of helps formulate and spit a lot of that information out for you. Remember, you can drive this initiative, right? You can help make this happen. So if you haven't seen one, this is the ASCO treatment summary and care plan. As I said, they often compile them together, and it's got that basic information at the top, right? Here's who you are, always good to have, and your key healthcare providers, and a treatment summary. What stage are you in? What are the diagnosis dates? What were the surgeries that you had? Any genetic history and risk factors for them to be aware of. And then it leads into your follow-up care. Okay, just like we talked about, all those pieces in there. When are your next visits? How long far away should I be? What are possible side effects I might have? And here's a little bit of that checklist that I was talking about as well that NCCS has. Looking at these are some issues you may experience. I mean, many times it can be all of them, but based on your diagnosis and your treatment, that you might be more prone to one or the other, and things to keep in mind there. Again, that's just a sample. Many providers have their own or they're modifying it, but that helps you get a visual of it. So when you're compiling information, some questions to ask. So you can help your team create this. So if timing is an issue, as you're pulling that information together, maybe you've switched providers midway or you moved. So you can help create that plan, right? Or creating your own if it's not going to be able to be offered to you. So some additional questions to kind of think about and talk. What treatment drugs have I been given? Do I need to seek follow-up care? Am I going to get cancer again? Now that I've finished, who's going to be responsible for monitoring my care? Very important. I have my plan, now what? So you want to make sure that you keep this plan, that you have a copy of it, that you have a copy given to your primary care, your oncologist, everybody on the team around you has a copy of it. And remember that this is a live document. Okay? So that you need to continue to have this document. You're going to make changes to it. It will need updated as time goes on. If something changes in your health condition or a new update, you need to update your plan, and then you need to remember to share it with the appropriate parties. Keep it in your personal file. If you have a bag or a binder, put it in there. That's something that should have its own section. It should be on the top of things as it changes. So some key takeaways that we kind of reviewed: self-advocacy. Remember to communicate your need to live your best life with cancer. You are the key person involved in all of this. It is you, it's impacting your body and your life, and you need to make sure that you are being an advocate for yourself and speaking up and being assertive. And if you aren't comfortable with that, bring in that caregiver or that friend that is, and have them do it and be more direct for you. But make sure that you are speaking up. Look at the shared decision making. Open communication between you, the patient, and the provider. That you're really working together to determine a care or treatment plan that outlines the risk and the benefits, while also balancing your values, your preferences, and the medical best practices. You need to bring all that in together. If there are religious reasons you don't want to do that, or location issues that you don't want to do that, or family issues, we want to find it and make sure that you're doing the right thing to help you, but you need to make sure you're communicating that and that you're part of that decision. You're getting a treatment summary, which is a summary, a review of everything that happened to you during your treatment, dates and side effects, and how it impacted you and the specifics. And then your survivorship follow-up care plan. So where is that going to take you going forward? What you need to put in there. And make sure to keep a copy for yourself. Okay, so too much show you just very briefly. And I'm happy to take any questions and everything too right there. So I can start sharing.
Yes.
To do perfect.
Thank you so much. Now we're going to do a little Q&A. So if anyone watching has any questions, drop some in the chat. I see we already got one from Lauren. I know you've kind of touched on this throughout your whole talk, but can you just run us through the process of how we can get a bag?
Oh, definitely. You can order a bag on our website. It's bagatcancer.org. And we have a booth in the exhibit booth area as well. And there's a little bit more information in a video that shows one. Medical providers offer them sometimes. We offer them on our website. We do ask for you to help cover the cost of them. It is a printed binder with a lot of resources and 4 different publications. So we ask people to help cover a portion of the cost. But if you're not able to, because we understand and know that cancer is very expensive, so we are a nonprofit and we do lots of fundraising for it. So we actually, there's a link there that you can just fill out the form and give us your address. We don't ask for any, financial information. Just fill it out and submit it, and we will send one directly to your house. And we actually have a couple of specialty bags as well. So most of the bags are non-cancer specific. We do not have an ocular one, but we have started, and we have one for CLL cancer and stomach cancer as well. So there's a few specialty ones, but most of them are applicable for anyone with any type of cancer to help you get started.
Great, thank you. And someone else wanted to know, can you explain the difference again between treatment summary and care plan?
Yes, so a lot of times, as I said, you'll see them combined a little bit, as we saw in the ASCO one, that it's your treatment summary and survivorship care plan and kind of compiled into one document. But your treatment summary is just that. Go back to your early school days and a summary of something. It's summarizing all the treatment that you have. So it's got a quick review of your diagnosis and the treatments and the dates and all of your contacts and any side effects that you have. And the care plan, the survivorship care plan, because we also talked about kind of your treatment care plan early on, but your survivorship follow-up care plan is really for going forward and what you need to be on the lookout for, when you need to go back in for regular screenings, other pieces that you will need, and what to look out for down the road.
Great, thanks. Okay, so we have time for a few more questions. I just want to remind everyone to drop those in the chat if you have them. Someone wants to know, where would you suggest someone begin in getting all this started?
If you are finishing up treatment, then I would really encourage you to ask your provider about a treatment summary and care plan if they have not mentioned that to you, and get that started. If they're not really jumping on board or they're not as familiar with it, again, it depends on the providers. Go check out ASCO, and NCCS has a great, and their website is canceradvocacy.org. And they've got a whole survivorship area where they've got a survivorship checklist and walk you through it. And then they have links to take you to both ASCO and OncoLink, where you can start to help develop your own survivorship care plan.
Great, thank you. So we got a comment, awesome resources. She's right, thank you so much for your resources. I'm not sure there are any more questions right now, unless someone is about to drop one in the chat. But I just want to remind our attendees that if you do come up with questions later, you're free to ask them to Mindy Griffith in the Socio app. So just use your Socio app, go to the speakers, and you will be able to connect. And Mindy, if you have any, last things to say.
No, just remember that this is about you. So make sure that you speak up and ask those questions. And no matter how hard it is, that you want to make sure you have your best quality of life and can enjoy it. So so use your words.
Right. Well, thank you so much for that. I think there's been some really meaningful takeaways. So we're going to go ahead and move into our 10-minute break. And thank you so much. And we'll see you all in table mode.
Thank you. Thanks for the opportunity to share with you guys. Have a great day.
You too.